February, we're taking your health to heart. We're putting a focus on cardiovascular disease as it's the leading killer in women. It claims more women's lives than all forms of cancer combined. So joining me now is Dr. Mariko Harper. She's a cardiologist with Virginia Mason. Good morning.
Good morning.
We're so glad to have you here.
Thank you for having me.
You're here, Mariko, to talk about the issues, the signs, the symptoms, and why this is a bigger problem for women than it is for men. So thank you for coming in.
Yeah, thank you for having me.
So what are some of the things that we need to be looking for as women and men with our heart health?
So as you said, it is the leading cause of death for both women and men. But women often present atypically, and they sometimes miss their symptoms of heart attacks. And so much of cardiovascular disease is preventable if we focus on modifying our risk before an event happens. In fact, up to 80% of heart attack and stroke is felt to be preventable if we take the steps now.
So what are some of these steps we can be taking in order to prevent CVDs?
Cardiovascular disease. So great question. So there's a few numbers that we should all know. First, blood pressure. Hypertension increases our risk for future heart attack and stroke. A normal blood pressure is less than 120/80. There's a lot of things that we can do with both medicines, but also not without medicines, through lifestyle, exercise, diet, to improve our blood pressure. So the first step is knowing if you have high blood pressure or not, and then seeing your healthcare professional if you do.
So you mentioned some of those signs that, maybe sometimes they're different for women. What are these signs that we need to be watching for both women and men?
Absolutely. So I had a patient yesterday who saw me in clinic and said, Doc, when I was having my heart event, I never had chest pain. I was expecting to have chest pain, but he said it was chest discomfort. It was pressure. It was heaviness. And that is exactly what pain from the heart feels like. It rarely is a sharp, stabbing pain. It's much more likely to be a deep pressure, an ache. And while men and women both are more likely to present with chest discomfort, women are also more likely to present with atypical symptoms. Sometimes this feels like nausea or sudden heartburn when they've never had heartburn before. Sometimes they feel dizzy, extremely short of breath, and sometimes the discomfort isn't in the chest, but it could be in the upper abdomen, in the jaw, in the neck area, upper arms, and radiating down the arms. So there's all sorts of symptoms. But if you're thinking that you might be having a heart attack, don't hesitate to call 911 and seek urgent medical attention.
So is there any truth to that old adage that you smell burnt toast? Is there any truth to
that?
I
can't say that I've had a patient ever tell me that.
Okay, because I've definitely heard that. Okay, so we know that family history is incredibly important here.
Absolutely.
Tell me about what someone needs to equip themselves with if they're going to a doctor.
It's really important to ask your family members about their own cardiovascular health, especially first-degree relatives. While we know that up to 80% of heart disease can be prevented through lifestyle changes, the other part is in large part genetics, meaning what family you're born into. If your mother, your father, or your siblings, those first-degree relatives, had heart disease at a young age, you're more likely to also experience heart problems at a young age. Young age or premature cardiovascular disease is considered an age of less than 55 for men or less than 65 for women. So it's important to not only find out if you have heart disease in the family, but how old your family members were when they first presented.
Because we definitely know it can happen to just about anybody.
Absolutely.
We've seen it in young women.
Absolutely.
Yeah.
And sometimes there are no signs until you have your first event. So it's really important to know your numbers. Yeah. Get your cholesterol checked. There are some markers there, especially that HDL or that good cholesterol. It has a strong genetic link. So sometimes we can improve it. In fact, many times we can improve it with diet and exercise. But if it's very low, that might be a marker that you're at particularly high risk for cardiovascular disease in your future.
Wow, you've really covered a lot of topics here and given us a lot of tips and information. If people need more, they can go to heart.org.
Absolutely. There's plenty of information, and there's a lot of information there where you could work on your own cardiovascular fitness. Tips about exercise, getting that 150 minutes per week that we're really trying to aim, all of us, and how to eat better to improve our health.
Absolutely. And we are going to be visiting with Dr. Mariko after the show. She'll be on Facebook Live with us. So be sure to join us after the show, and we'll get some more questions answered from our viewers and get some more information for you. Thank you so much for being with us this morning.
Thank
we
you.
really appreciate it as we kick off Heart Month. We want to head over to the Weather Center now because we know we're taking steps for our heart too, right, Grace?